Welcome to today's lecture on the pathophysiology and management of acute tubular necrosis, ATN. ATN is a common cause of acute kidney injury, and understanding its underlying mechanisms is crucial for effective diagnosis and treatment. Ischemic ATN occurs due to a reduction in renal blood flow and subsequent hypoxia, leading to renal tubular cell death. The initial insult, such as hypotension or renal artery occlusion, triggers a cascade of events, including vasoconstriction, endothelial dysfunction, and disruption of the tubular epithelial cell barrier. Impaired blood flow causes hypoxia, leading to the production of reactive oxygen species and the activation of inflammatory pathways. These cellular and molecular events ultimately result in tubular cell injury and death. Nephrotoxic ATN is caused by exposure to certain medications and chemicals that have toxic effects on renal tubular cells. These substances can directly damage tubular epithelial cells, disrupt cellular processes, and interfere with tubular transport functions. The mechanisms of nephrotoxicity include impaired mitochondrial function, oxidative stress, apoptosis, and inflammation. Understanding these cellular events and molecular interactions is crucial for identifying nephrotoxic insults and developing appropriate preventive measures. Distinguishing between ischemic and nephrotoxic ATN is essential for appropriate management. Clinical features, laboratory findings, and imaging modalities can aid in this differentiation. Ischemic ATN often presents with a history of hypoperfusion, while nephrotoxic ATN may occur in patients exposed to nephrotoxic substances, such as aminoglycoside antibiotics or contrast agents. Laboratory findings, including urine microscopy and biochemistry, can provide valuable insights. Imaging modalities like Doppler ultrasound and renal scintigraphy can help identify underlying vascular or toxic causes. Early detection of ATN is crucial for initiating timely intervention. Specific biomarkers, such as neutrophil gelatinase-associated lipocalin, NGAL, kidney injury molecule 1, KIM1, and interleukin-18, IL-18, have shown promise in detecting ATN at its earliest stages. By measuring these biomarkers in urine or blood, clinicians can identify patients at risk for developing ATN and intervene proactively to prevent further renal injury. Histopathological examination of renal tissue affected by ATN reveals characteristic microscopic changes. These include tubular cell damage, detachment, and sloughing, along with intraluminal cellular debris and occlusion. Inflammatory infiltrates, predominantly composed of neutrophils and monocytes, are also observed. These histopathological findings aid in confirming the diagnosis and understanding the extent of renal injury. ATN leads to significant alterations in renal hemodynamics. Reduced renal blood flow, glomerular filtration rate, and renal perfusion contribute to the pathophysiology of ATN. The release of vasoactive mediators and increased tubular pressure further exacerbate the injury. Understanding these hemodynamic changes is important for appropriate fluid and vasopressor management in patients with ATN. Inflammatory pathways play a vital role in the progression of ATN. The release of pro-inflammatory cytokines, chemokines, and adhesion molecules perpetuates tubular injury and triggers innate immune responses. Neutrophils and macrophages infiltrate the damaged tubules, contributing to tissue destruction. Modulating these inflammatory pathways may have therapeutic potential in managing ATN and limiting its progression. In severe cases of ATN, renal replacement therapy, RRT, becomes necessary to maintain fluid and electrolyte balance and support kidney function. RRT modalities, including intermittent hemodialysis, continuous renal replacement therapy, and peritoneal dialysis, can provide effective renal support. The selection of the appropriate RRT modality depends on the patient's clinical status, hemodynamic stability, and overall renal function. Maintaining fluid and electrolyte balance in patients with ATN can be challenging. Fluid overload and electrolyte imbalances can negatively impact renal recovery. Prudent fluid management, taking into account factors such as urine output, hemodynamic stability, and electrolyte disturbances, is crucial for optimizing renal function and enhancing the patient's overall prognosis. One specific cause of ATN is contrast-induced nephropathy, which occurs following the administration of contrast agents in diagnostic procedures. Strategies to prevent and manage contrast-induced ATN include promoting adequate hydration before and after the procedure, considering alternative imaging modalities when feasible, and minimizing the use of high-risk contrast agents in vulnerable patients. Close monitoring of renal function and timely intervention are important in mitigating the renal injury associated with contrast agents. Oxidative stress plays a significant role in the pathogenesis of ATN. Reactive oxygen species are generated during ischemia reperfusion injury or exposure to nephrotoxic substances, leading to cellular damage and renal tubular injury. Understanding these mechanisms may provide insights into potential therapeutic approaches targeting oxidative stress and minimizing renal injury. Emerging treatment strategies and experimental interventions are being explored to improve outcomes in patients with ATN. These include drug discoveries targeting specific pathways involved in ATN pathogenesis, cell-based therapies aiming to regenerate renal tissue, and regenerative medicine approaches utilizing stem cells or tissue engineering. Although these approaches are still in the early stages of investigation, they hold promise for the future management of ATN. In summary, acute tubular necrosis is a complex renal condition with diverse factors. Differentiating between ischemic and nephrotoxic causes, using proper diagnostic tools, and employing appropriate management strategies are crucial for patient outcomes. Further research is needed to improve prognosis and minimize the impact on renal function.